Flaks, the President and CEO of Hartford HealthCare, and this is our second in a series of Hope from the Frontline. As we battle COVID-19, I have found in talking with so many people within our community the importance of really helping give people hope and understand what it's like working today in the healthcare organization and addressing these really unprecedented set of circumstances. So today I'm very excited. We have a wonderful leader from our organization joining us, Keith Grant. And Keith Grant is an advanced practitioner at Hartford HealthCare. He's the system director for infectious diseases. And Keith has a fascinating background. First of all, born and raised in Jamaica, came here to the greater Hartford area as an adult, and spent more than 10 years in the Air Force, serving as a flight nurse in a whole series of capacities, both being deployed to Afghanistan, Iraq, working in Germany, working in the United States on the Edwards Air Force Base. So just doing extraordinary things throughout the world. And Keith, I have to tell you, when you think about the things you've encountered in your professional life, in your career, and to now be here now, working in COVID-19, what is it like? How do you compare it? You know, how do you feel your background prepared you for this moment? And at the same time, how do you experience this against everything else you've seen and done?
Jeff, thank you so much for absolutely for having me. And to answer your question, I think the experiences that I've had definitely have prepared me for this. I think the watching what we've done in the military in regards to addressing and reacting and responding to critical incidents, I think have prepared me significantly for this. But I also believe strongly that our preparation here has definitely prepared me as well.
So early on, when you were in the military and you ended up specializing in infectious diseases, it was somewhat of a reaction to then an emerging issue around H1N1.
Absolutely. So I had the opportunity, coming from a medic, to be involved in infection prevention, infectious disease in the military, and it was not a position that was busy at that point. And right after my appointment, H1N1 occurred. And that position became significant with coordinating and working with the base and different entities in order to figure out at that point something new from an epidemiological perspective. So after leaving that position and within the civilian world or within my normal job focus outside the military, I decided that this was intellectually so interesting that I needed to be more involved with it on the civilian side.
So Keith, how do you react? You know, people often describe what we're experiencing now as battlefield management. You know, we have to make decisions faster, we have to trial things without the benefit of luxury of time, and we have to be decisive and assume some level of risk, and clearly our frontline healthcare workers, the bravery, the courage they're working with. So you've been in battlefields,
yes, and
now you're working here on the front line of our organization as a leader, helping drive, our response for COVID-19. How would you explain that?
Very good parallel. I think it's exceptionally good parallel. When you look at the stress level of any circumstance, from being a medical crew director, a flight nurse, any stressful situation, you parallel them just the same. Being on the front line, being as a leader, as an officer, the decision-making process is very, very much the same. The commitment, one thing I would say, the commitment that individuals have in the cause and ensuring that people are safe, ensuring that in this case patients are safe, is very much the same. The impact that this traumatic event has on, we look at PTSD, the impact that this has on our soldiers and our airmen, I expect is the impact that we're seeing now from exhausted healthcare providers, from stressful situations within the healthcare realm.
It's amazing. I mean, to see the environment that people are working in today, it's like something completely unprecedented, certainly in what we do in our healthcare systems. Tell us what it's like. Keith, you are on the front lines. You are with our staff. You are training and developing our staff. You're responding to specific patient circumstances. Everyone out there who's not in the position you're in often are wondering, what is it being experienced today in the moment?
So for me, one of the most stressful thing and the most concerning thing is to ensure that whatever decision we make in a boardroom, whatever decision we make in boardroom situations, whatever theoretical model we put together, is to ensure that represent the proper risk assessment. It represents something that can be operationalized and done on the front line, and it's the best situation for our staff and colleagues. And for me, I think that's my primary focus, and I think for me, that's what it's like being on that level of frontline.
Well, we're enormously grateful for what you're doing. If you could describe, clearly across the country, across the world, we've never imagined we would need personal protective equipment at the level that we do today, and that we would be under the type of pressure to provide it. We've worked incredibly tirelessly at Hartford HealthCare to bring personal protective equipment from around the world here, 24 hours a day, 7 days a week, in fact. Tell us, with the measures we've put in place, the protections we've put in place for our frontline staff, tell us about how it's working, what the results are, and your own perspective.
Absolutely. That's a very good question. I think obviously our primary role supported significantly by Jeff and his team is to ensure that the appropriate risk assessment is done, the appropriate PPE gets to the appropriate areas, and then at some point we'll get data. So the data that we look at is, for example, staff that are positive for the disease process, and with expanding our testing capability, we have the ability to really have a good snapshot of people that have symptoms, and we'll do testing immediately and see staff that are positive. I think at this point, Hartford HealthCare is at a 0.81% for positive staff conversion. I think when you look at the numbers coming out of Italy, coming out of Spain, that's pretty significant. I think there's some healthcare system within Spain that reported a 40% contamination rate for healthcare personnel. I think there's some healthcare facility within the United States that reported upward of 5 to 10% positive conversion rates.
Wow.
Now, when you look at our patient population, we've had scenarios wherein we've done a point prevalence, which basically means that if something looks, from an epidemiological perspective, something looks like it's off, or there's an increase, we would do an exceptional study or an exceptional set of testings per se to ensure that we're not contaminating or cross-contaminating. And we've had scenarios that prove that our PPE process works really well, in that we had a staff that's positive, and any patient that staff took care of, we're very proud to say that we've had no cross-contamination throughout Hartford HealthCare at this point in time. And I think that's something that give me some reprieve. It makes me feel like what we're doing here, the decisions we've made as leaders within the system, is working on the front line.
Wow, that's really fabulous, and we need to do everything possible to protect our frontline healthcare workers, and it's providing the proper PPE, but it's also providing the training and the support around that. When we started this process in our original response, Keith, we've talked about two things early on. It was about information, and it was ultimately then be about testing. So describe your perspective now, looking back over the last month, about information and testing and how that has had an impact on what's occurred here within Connecticut.
So the first public forum we came on, and the first thing that we asked off the public, and the first commitment, one of the first commitments Hartford HealthCare did, was to ensure that we identified what would be necessary in order for us to curb the spread. And it wasn't information that was primarily for Hartford HealthCare, it was for the entire community of Hartford. In fact, based on the communications that we've gotten, based on the use of the infrastructure that we set up, this wasn't just for Hartford, it was for quite possibly the country, because we had calls that are coming from everywhere in the country. And the information in multiple languages provided through a hotline, I would say, has contributed significantly to what we're seeing now as a downward trend, or a decrease in the rate of increase, which is exceptional. It also has contributed to the discussions that we're having now to reopening, the discussions we're having now to lift some of the restrictions from social distancing, so to speak, and get back to what's normal. The other very important piece of it is, in order for us to have an epidemiological snapshot of what's going on, we saw the need to expand our testing capability. And at this point in time, when we made this decision, this was done with exceptional regards for the limited resource. So,
Right.
we decided how and where we're going to move it out, but all the information was available for the general public, for every single person. It was very easy to access, and that's something we put a lot of effort into. So when you look at the things that's needed in order for us to go back to a normal state, Hartford HealthCare has been on the forefront of putting that stuff forward, and I'm very proud of being a part of that in the discussion in ensuring that information is available, and in discussion in ensuring that the appropriate testing and the availability of testing is available.
So Keith, you're an expert, and you've had incredible experiences both here within our health system, but across the world in your work with the Air Force. And you continue to be a member of the Air Force National Guard, and we thank you for your service immensely.
Absolutely.
When you look at the questions we're confronting now across the state, big decisions that have to get made about where and how we reopen, what new normal looks like. Give us your thinking.
So I think we have an opportunity to get this very, very right. And if you look back in history on pandemics, one of the things that we discuss a lot, and we will discuss it based on multiple pandemic and historic pandemics, is that second wave. And my perspective has a lot to do with having faith in my fellow citizens, having faith in Hartford HealthCare as a system, and having faith in other health systems, in passing the appropriate information out. And my faith is that the second wave that we see here will be limited. It will be less than hopefully expected, primarily because the appropriate information will go out. The appropriate strategies will be taken by our citizens, and I think that's what's necessary. So if we can open up or make available testing capabilities, which we've done, we're doing, and we're working on, and we will continue to expand. And if we can continue to deliver the right information to people in regard to social distancing, it's still necessary. So we open up, but still keep in mind, if you have symptoms, the things that you need to do to protect yourself and the other vulnerable population.
What does the new normal look like? If you look into the summer months,
Yes.
and you think about sporting events, entertainment venues, celebrations within families and so forth, how do those things happen? Will they happen? Can they happen?
I think this distance that we've had from our families and our friends have gotten us a lot closer. So I think that's one of the most important things. I think this distance has definitely gotten us closer.
Right.
I think people are going to hug each other a lot longer, a lot stronger through this process when this is all said and done. I think any opportunity to be together, people are going to use it. But I think in the back of people's mind, they're going to be cognizant of the fact that, if a cousin has symptoms, I guarantee someone within the family is going to quickly say, you know what, you should probably not be around our elderly aunt, and they'll mitigate within themselves, and I think that's a good thing. But I think what I see happening is people have gotten, and based on the communications I've gotten from my family, based on the communication that I've gotten from friends, people have gotten significantly closer in this time of separation.
How will things be different? So when you think about post this experience, COVID-19, for a country, for the world, how do we expect certain behaviors, certain approaches to the way people live, to the way society functions? What are you anticipating?
So I think what we've done through the last few months, we've realized that in order for a lot of things to work, we have to work together. Right. So I think we will see a lot closer collaboration between groups. But we should expect, for example, we should expect more testing. We should definitely expect more screening. So if you go into certain venues, I would expect people to have like temperature checks, so to speak. Right. That's going to be more widely across the state, and I expect it to be across the country. I'll expect more posters. I will expect more public announcement and public messaging in regard to symptom and symptomology, symptom management. I will expect more simple communication to the public as to the simple things that we could do to move this forward. And
how do you, when you think about returning to normal for healthcare, healthcare is an essential service, yes. and people need services. And for us, one of the things that's been most challenging is having to restrict things that people characterize as elective surgery, when truthfully all surgery is necessary, when it's deemed necessary by a surgeon. When we think about these types of things, we're going to be caring for people who have COVID-19 and will be within our institutions, and at the same time, we're going to be doing a whole series of services for people who do not have COVID-19, and they'll be happening simultaneous within the same healthcare setting. How confident are you we can do that safely and well?
We definitely can. So I think we're building risk stratification models. We're building models which includes more advanced testing. We're building models that will look at cohorts or groups that we probably should be testing more. We're building models that will allow the appropriate PPE to be in the appropriate areas to prevent any form of spreading. The other thing that we're looking at is what's called contact tracing. So we're building and investing in models for contact tracing, which means I'm now able to tell that this person was positive and this person had contact with a number of people within the last few days, and these are people that I should also pay attention to. So I think with contact tracing, with testing, with screening, we're building and putting in place a number of things in order to ensure that our healthcare providers are safe and we're able to provide all services that Hartford HealthCare have done very well in providing in the past to all our citizens.
Wow. So let me ask a final question, Keith. For you've encountered thousands of our staff working on the front lines of healthcare today, and you've been shoulder to shoulder with them, and you've been with our patients who are battling COVID-19. What would you say you've learned more than anything from this experience? And what is your takeaways when we look at the heroes, the people working on the front line today?
Resilience and commitment, I think, are the two big things. I think, so when this started, there is not one staff member on the front line that came and said, this is not something I want to do. That's not a communication that I got. The communications that we got is, I know you guys are doing the best that you can, or I know you guys will do the utmost in order for us to be safe. And I think that's a very proud moment for me. And it made me know that this is something, to know that the general population believes that this is something that we're going to do. It makes me even more commit to the fact that this is something we're going to do and ensure that our staff are safe.
Wow, Keith, I'm so proud to call you a colleague. I have enormous respect for you, your expertise, and my gratitude to everybody working today in the front lines of healthcare. They're serving us, they take care of us, they protect us, and they're treating our people in our community who are most vulnerable. So we thank you for your efforts. Please keep doing what you're doing. Keep leading from in front. We love the innovation that you're driving, and keep ensuring that we're putting every protection in place that we can. Thank you so much, Keith Grant, for joining us today.
Absolutely. Thank you so much for your support, Jeff. Thank you.
My pleasure. Thank you.